Good evening, everyone. Today is February 8th, 2020. This is your Wuhan coronavirus update for the day. As of today, there are 37,135 confirmed cases, 806 confirmed deaths, 2,623 confirmed recoveries. This lowers the mortality rate down to 24%. I still don't believe this is an accurate measure of the outbreak, but I am glad to see the mortality rate dropping gradually over time. Here are a few things that have come to my attention over the last 24 hours. The first American died from the novel coronavirus. This was going to happen eventually. An American died in China from the coronavirus yesterday. It's a tragedy that I hoped would never come. Now more Americans will hopefully begin to pay attention to this outbreak and take it a little more seriously. Also, the World Health Organization is cautioning that transmission of the new coronavirus outside of China could increase. I believe they are slowly priming the globe for the fact this virus may continue to spread across the world. The governments across the globe, as well as the media, have been trying to keep people apathetic about this disease. They are trying to prevent panic and hysteria, and I am with them. What I do not agree with is not informing the public of the seriousness of the matter. There are an increasing number of new cases of person-to-person transmission popping up across the globe. It's only a matter of time before they balloon into localized outbreaks. Once localized outbreaks occur in Europe or the United States, Australia, or anywhere else for that matter, people will begin to panic more than they are at the current moment. There were 5 Britons infected in France yesterday as well. A British man spent January 20th to the 23rd in Singapore. He then traveled to France on January 24th. He was there for 4 days on vacation and returned to the United Kingdom on the 28th. This man infected 5 other Britons while in France, including a child. What makes this interesting is 2 key facts. First, the first case in Singapore wasn't confirmed until January 23rd, the day this man left. So there was an unknown outbreak actively occurring while this man was in Singapore. As of today, there are 40 confirmed cases in Singapore, but this man was infected either before or on the same day the first confirmed case was discovered. Second is the time from infection to becoming contagious. Let's say he was infected immediately upon arrival to Singapore on the 20th. He arrives in France on the 24th and leaves on the 28th. This means he became contagious anywhere between the 4th day to the 8th day from infection. If he was infected on the 23rd, he became contagious anywhere from the 1st to the 4th day of infection. What makes this big news is the average time from infection to hospital visit has been recorded as an average of 12 days. So let's say the basic reproduction number of this disease is 2. If someone became infectious on the 8th day of illness, by the time they go to the hospital on the 12th day, there would be 1.5 generations of infection, meaning the individual infected 2 other people. Now, this is the best case scenario. If he takes 4 days to become contagious, there would be 3 generations of infection, meaning a total of 8 people would become infected by the time the patient went to the hospital. He would infect 2 people, they would infect 2 people, who would infect 2 people. If they became contagious after 1 day, there would be 11 generations of infection, which would be absolutely catastrophic, meaning by the time he went to the hospital, every infection would have created 2 more, equaling 4,096 infections. This leads me to believe that there is an undocumented outbreak, and we are witnessing the incubation lag time, which will lead to exponentially increasing outbreak in Singapore over the next month. Be sure to keep an eye on that. Lastly, there was a study conducted in a hospital in Wuhan. What it showed was of the original 138 patients in the hospital to be confirmed infected, 41% were presumed to have been infected in the hospital itself. Now, this is an unusually high amount of infections to take place inside of a hospital. Some were staff, some were patients there for other issues. What this reflects is the highly infectious nature of this disease. What's most concerning is the asymptomatic nature of the spreading of this disease, as well as the fact that it took, on average, 7 days from onset of symptoms to hospitalization. How many people are being infected before these individuals seek medical attention? Unfortunately, most of them may not know they are infected or contagious. The incubation lag time and asymptomatic nature of this spread are the 2 key factors that make this disease impossible to contain. The only option, the only solution, is massive world isolation. Everyone, and I mean everyone, needs to isolate themselves for at least 45 days, in my estimate, 3 months, in order to eradicate this disease. The sooner, the better. If this does not happen, this virus could turn into the super flu and kill thousands, if not hundreds of thousands, each winter. I don't believe this will end the world, but it may very well end the world as we know it. Stock up on food, stock up on water, and prepare yourself for isolation. Do it for yourself and your family. It's better to be safe than sorry. This has been your Wuhan coronavirus update for the day. I hope it helps.